With a question, please.
Yep. Thank you, President. My question is for the Minister for Health and relates to access to abortion services in the public health system in Victoria, particularly for those who can't afford to pay for it privately. And you may recall I asked a similar question last year when you were acting for the Minister for Health. And you gave me a whole bunch of answers around more training in the women's, 1800 My Options, new family planning hubs. So I'm just wondering, in the last year, have we seen an increase in the availability of terminations in the public health system?
Minister.
Thank you. I thank the member for her question, and I acknowledge her strong advocacy for greater access to termination services for Victorian women. And in fact, I know that this has been an issue that we have managed to achieve some bipartisanship, and Ms Wooldridge and others also have supported the government around these issues, and I note Mr Finn's strong objection to me including the whole of the coalition in that statement. So I'll be very clear in saying that I know Mr Finn will continue to oppose women's right to choose in Victoria, and I hope he will make sure that a whole bunch of neo-Nazis don't continue to march with him around these issues in Victoria, because we know that it is important that women do have the right to choose in our state. This is why previous Health Minister, Minister Hennessy, launched the Women's Sexual and Reproductive Health Key Priorities document back in 2017. And that policy set in place the establishment of 8 reproductive health hubs being established in Victoria. This has enabled women to gain greater access to contraception, including the long-acting reversible contraception, medical terminations up to 9 weeks, and referral pathways to access to surgical terminations when a medical termination is not suitable. Those centres are now operating, including in regional communities. Bendigo, Ballarat, Albury, Wodonga, Wangaratta now have access to these hubs. And in addition to that, we established the new 1800 My Options service, which the member referred to in her question as well, which is run by Women's Health Victoria, and I acknowledge the important work that they're doing, making sure that women have access to additional support and information around these services. Look, I will seek some additional advice for the member. She asked specifically around data. I'll look at what data sets are available around these issues, but we're absolutely committed to addressing gaps. This is an issue that I look forward to working with my colleagues at the COAG Health Council, including the federal government. I do think that there is certainly some inequities that exist, and this is an issue that I will continue to do some work on. But we certainly have, since we have been in government, expanded access to women's choices through the establishment of those hubs, but there's certainly more work that needs to be done.
Ms Patten on a supplementary.
Thank you, Minister, and I'll look forward to getting that extra information. And certainly, in regards to the hubs, certainly we'll be speaking to you at a later date about possibly getting a hub in our North Metropolitan region. But by way of supplementary, part of those priorities was to provide training to more clinicians at the Women's to provide surgical terminations. And I'm wondering if you could tell me how many more clinicians have been trained to provide terminations at the Women's.
Minister.
Thank you very much. Look, I'll be looking to see what data is available to provide the member with in response to that very specific question. But I know that the Women's Hospital is very committed to giving greater choice to women. They do very important work around these issues. We know, of course, that our legislation provides some parameters around training and certainly around issues around medical terminations. I think that there needs to be more work done with PHNs and primary care providers to make sure that we've got greater access to medical terminations across Victoria, particularly in regional communities. And I'm happy to have some further discussions with the member around these issues, but certainly around the training issues more broadly, of course, that is a federal responsibility, but I am committed to looking to work with the federal government around providing greater training to doctors, greater training
Minister.
opportunities for medical practitioners.